Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 7 Common dry cough causes and treatment remedy options you can try. A dry cough occurs as a natural reflex when inflammatory or irritation affects your airway. It is also called an unproductive cough since it does not produce phlegmormucus. A dry cough can be classified as acute or chronic, based on its duration. /r/n/r/n A dry cough often occurs as a result of an upper respiratory infection and resolves with the course of the disease. However, it can also be a sign of chronic health problems such as acid reflux or asthma. Treatment of a dry cough depends on the cause. /r/n/r/nbrizmaker, Getty Imagesrnrn COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. It causes mild to moderate respiratory illness that typically does not require special treatment. However, older people and those with underlying medical conditions like diabetes, chronic respiratory disease, and cardiovascular disease have the highest risk of developing serious illnesses from COVID-19. /r/n/r/n The COVID-19 infection inflames your lung tissues, making breathing, getting oxygen, and removing waste more challenging. With COVID-19, adry cough occurs in about 50% to 70% of people who have the disease. /r/n/r/n While COVID-19 affects everyone differently, other common symptoms can include /r/n/r/n Most people do not require special treatment for COVID-19. However, your healthcare provider may advise treatment based on your age and other health conditions. COVID-19 treatments include /r/n/r/n Asthma is a chronic lung disease that affects the airways that carry air in and out of your lungs. With asthma, your airways become narrowed when you encounter specific triggers such as smoke, viruses, or allergens like pollen, causing an asthma attack and making it harder to breathe. /r/n/r/n Asthma can cause a dry cough when the small airway muscles tighten and swell. Other symptoms of asthma include /r/n/r/n Asthma treatment is complicated because it involves preventing symptoms and symptom relief. Asthma treatments include lifestyle changes and medications, as well as bronchial thermoplasty. /r/n/r/n Making lifestyle changes to avoid exposure to common asthma triggers that cause the airways to constrict include /r/n/r/n Quick relief medications to help prevent or ease symptoms during an asthma attack include /r/n/r/n Long-term medicines include /r/n/r/n Another treatment is bronchial thermoplasty. It is a procedure that involves the application of heat to the muscles along the walls of your airways to help prevent airway narrowing. It is done via the insertion of a bronchoscope, a tube with a camera at end, through your mouth to see inside your airways. /r/n/r/n Idiopathic pulmonary fibrosis, IPF, is a severe, progressive, and generally fatal lung disease that causes inflammation and/or scarring of your lungs' alveoli, air sacs, for unknown reasons. The scarring interferes with your ability to breathe because it thickens the lining of your lungs. This causes irreversible loss of the tissue's ability to transport oxygen until the lungs can no longer provide oxygen to your organs and tissues. /r/n/r/n A dry and nagging cough that worsens over time is a common early symptom of idiopathic pulmonary fibrosis. It can be triggered by factors such as exercise, laughing, crying, or breathing in smoke or other chemicals. /r/n/r/n Other symptoms of idiopathic pulmonary fibrosis are /r/n/r/n While there is no cure for IPF, treatments can slow down the progression of lung damage and help improve your quality of life. Treatment can include medications, breathing therapies, and surgery. /r/n/r/n Medications include /r/n/r/n Breathing therapies include /r/n/r/n Surgery includes a lung transplant for treatment of severe symptoms. /r/n/r/n gastroesophageal reflux disease, GERD, is a condition in which your stomach acid repeatedly flows back up into your esophagus, the food tube that connects your mouth and stomach. The regurgitated stomach acid is called acid reflux. Problems arise because this highly acidic substance can irritate the lining of your esophagus. /r/n/r/n While periodic acid reflux is common, it happens repeatedly over time with GERD. GERD can cause a cough when the acid and other digestive enzymes irritate your throat. This change in sensation or irritation can stimulate a cough. /r/n/r/n In addition to a dry cough, symptoms of GERD can include /r/n/r/n Treatment for GERD can vary based on the severity of your disease. Common treatments include changes to diet, medications, and surgery. /r/n/r/n Dietary and lifestyle changes include /r/n/r/n Over-the-counter OTC, and prescription medications include /r/n/r/n Surgery includes /r/n/r/n Postnasal drip, also known as upper airway cough syndrome, is a feeling of mucus gathering in your throat or at the back of your nose. When you are healthy, you swallow mucus unconsciously many times a day. /r/n/r/n However, factors such as seasonal allergies, some medications, GERD, and spicy foods can increase the volume of mucus or thicken it. This can lead to coughing as you try to manage the abnormal flow and texture of the mucus. /r/n/r/n Postnasal drip typically lasts for a few days or weeks, though it can become chronic and persist for months. In addition to a persistent dry cough, symptoms of postnasal drip include /r/n/r/n Treatment for postnasal drip varies based on the cause of the problem, including bacterial infections, chronic sinusitis, seasonal allergies, and GERD. /r/n/r/n For bacterial infections, /r/n/r/n Chronic sinusitis may require surgery to open blocked sinuses. /r/n/r/n Seasonal allergies may be treated with the following: /r/n/r/n If GERD is the cause, traditional treatments for this condition will be used. /r/n/r/n Measures to allow the mucus to pass more easily include /r/n/r/n Upper respiratory infections, URIs, are contagious infections that affect your upper respiratory tract, including your nasal passages, sinuses, and throat. The most common upper respiratory infections are viral infections, such as the rhinovirus, which causes the common cold. Viruses such as adenovirus and bacteria such as chlamydia can cause upper respiratory infections. /r/n/r/n A dry cough is a common URI symptom because these conditions affect your nasal passages and throat. Other symptoms of upper respiratory infections can vary by specific disease. These symptoms can include /r/n/r/n Treatment for an upper respiratory infection can vary based on the cause of the infection. Dry cough remedies can include medications and lifestyle changes. /r/n/r/n Medications include /r/n/r/n Lifestyle changes include /r/n/r/n Lung cancer is cancer that starts when cells in your lung mutate, develop abnormally, and grow out of control. It usually occurs from breathing dangerous chemicals, but can also develop without a known cause. As the abnormal cells grow, they join to form a tumor, which destroys surrounding healthy lung tissue. /r/n/r/n Lung cancer can cause a cough when it originates in your large central airways. A tumor can narrow the airway and cause coughing. While a dry cough can be an early sign of lung cancer, the disease affects everyone differently. In most people, symptoms do not occur until the disease advances. /r/n/r/n In addition to a dry cough, other possible symptoms of lung cancer include /r/n/r/n Treatment for lung cancer varies based on its type and stage. Depending on additional factors such as your age and other health conditions, treatment for lung cancer can include one or more of the following therapies, /r/n/r/n. There are many other potential causes of a dry cough. These include, /r/n/r/n. Smoking or breathing in smoke can sometimes cause a smoker's cough fast your body tries to clear the irritants caused by smoking. /r/n/r/n. About 10% of people who take ACE inhibitors develop a dry cough. These drugs, such as Vasotec, enalapril, and Zestril, lisinopril, are commonly used to treat high blood pressure. /r/n/r/n. Bronchiectasis is an obstructive lung disease that occurs from inflammation and infection. It causes permanent widening of your airways. Bronchiectasis occurs from inflammation and infection. /r/n/r/n. Cystic fibrosis is a progressive, and life-threatening condition. It damages the lungs and digestive tract. /r/n/r/n. Sarcoidosis develops when groups of cells in your immune system form collared granulomas. These small, red, and inflamed lumps can cause permanent scarring in your lungs and lymph nodes in your chest. /r/n/r/n. Pneumonia or other lung infections are contagious conditions caused by bacteria or viruses in your lower respiratory tract. They spread when an infected person coughs or sneezes. /r/n/r/n. Laryngopharyngeal reflux is a type of reflux, the return of stomach acid from your stomach into your throat, that triggers postnasal drip, the sensation of a lump in your throat, and a dry cough. /r/n/r/n. Environmental allergies are types of allergies cause your body to overreact to harmless substances in the environment. They can include pollen, mold, pet dander, or grass. /r/n/r/n. A dry cough can occur as a side effect of the following types of medications. /r/n/r/n. There are many ways to get rid of a dry cough at home. Choosing the best treatment depends on the cause of your symptoms. Since a dry cough can occur as a symptom of another condition, it is important to treat and manage underlying health problems. /r/n/r/n. At-home remedies encompass lifestyle modifications and medications. /r/n/r/n. These include, /r/n/r/n. These treatments include, /r/n/r/n. Prescription cough suppressants include the following, /r/n/r/n. With so many potential causes, it can be difficult to know whether your dry cough is a minor inconvenience or a symptom of a serious medical condition. To ensure you're not ignoring warning signs of a potential health problem, consider the following guidelines for when to seek medical attention for a dry cough. /r/n/r/n. Contact a healthcare provider for a dry cough that occurs with any of the following characteristics. /r/n/r/n. Call 911 or go to an emergency room if you have a dry cough with any of the following features. /r/n/r/n. In most cases, a dry cough is not a cause for concern. It typically occurs as a common cold or flu symptom that wanes as the condition resolves. /r/n/r/n. While home treatments can relieve symptoms, they do not cure coughs. Curing a cough requires resolving or treating the underlying cause. Knowing the source of your cough can help you manage symptoms and avoid triggers in cases of problems like allergies and reflux. /r/n/r/n. When a dry cough occurs as a sign of an underlying condition, it must be identified and treated to resolve the cough. Contact your healthcare provider if you have a dry cough that persists longer than 3 weeks or fails to improve with home treatment. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.